Hi, I'm Meredith Marr at the University of Maryland Medical Center Midtown Campus. Today we're discussing sinus issues with ear, nose, and throat surgeon Dr. Nidhi Gupta. Thanks for being here today.
My pleasure. Thank you for having me.
And thanks to all of you for watching. If you're watching our video right now, please continue to leave your questions for Dr. Gupta in the comments section below, and be sure to like our Facebook page if you haven't already. Dr. Gupta, what is a sinus infection?
So a sinus infection is caused by sinusitis. And is inflammation of the sinuses. The sinuses are air-filled cavities that we have in our heads, and we have multiple of these cavities. There is a mucous membrane surrounding that cavity, and typically, again, it's filled with air. When we get an infection, sometimes we get fluid in that cavity, and you produce extra discharge, and that's where we get the discomfort from sinus infections.
What are some of the symptoms of a sinus infection?
People often come in with a headache, facial pain and pressure, tooth pain, eye pain behind the eye, between the eyes, and they'll notice a significant amount of discharge, different than what they may typically have. So this discharge may be thicker, green, yellow. Also, sometimes people will come in with fevers as well.
Is there one symptom that seems to present itself first, so someone can be able to tell ahead of time if they're developing a sinus infection and they can get ahead of the game?
Well, unfortunately, sinus infections are there's a few predisposing factors. So one is allergies. So if you have a flare-up of your allergies, that may predispose you to a sinus infection. Also, a cold is a predisposing factor to a sinus infection as well. Almost all sinus infections originate from some sort of a cold.
How can you treat a sinus infection, both at home on your own, and then once you feel like it's gotten bad enough to the point where you need to see a specialist, what are the treatment options?
So oftentimes controlling the inflammation. So sinus infections are caused by either viruses or bacteria. If it's caused by a virus, unfortunately, we don't have any medications to really cure that. What we do provide, though, is supportive care. So you want things that are going to help you decongest the nose, help those sinuses clear and allow them to drain so that you don't have that buildup of pressure. Because of the buildup of pressure, you'd want to take some pain medicine. And sometimes some of the rinses, the saline rinses and some of the nasal saline sprays help to flush out the nasal cavity and help clear the infection.
And I see you have one of them in your hand right now.
I do. So this is a steroid nasal spray, and so we often use these to treat allergies, which can be a predisposing factor to sinus infections.
Okay.
The key, though, is to use them properly. So these are medications that were originally prescription strength, and they still are, but they're available over the counter. Using them here and there really isn't a very effective way to use them. You have to use them consistently over time, and then gradually the inflammation decreases in the nose. And so I do like to demonstrate how to use them to patients because it isn't always straightforward. So most times you think you want to place the nasal spray in the nose and then just spray. But in reality, you want to place the nasal spray in the nose, tip it back, and aim a little to the outside of the eye, and then spray 2 sprays on each side. So again, you're going to take that spray, stick it in the nose, aim back towards the back of your head, a little to the outside, and 2 sprays. And you do that once a day, every day. The key here, though, is you can't use it as needed. You have to use it every day consistently, and you really notice the benefit at 4 to 6 weeks. So I talk a lot about that as it relates to sinus and allergies, more so than just sinus infections acutely.
So you mentioned allergies may be a reason why someone develops a sinus infection. What could the possible other reasons be?
So the common cold, that's a predisposing factor. The colds that maybe just don't go away and they're causing continued inflammation in the sinuses, which causes continued fluid production. And when that fluid gets stuck, you get that pain and pressure causing a true sinus infection. So colds that go on for longer than 10 days, I start thinking about a sinus infection if you also have that pain, pressure, fever. Also, sometimes just because you get a virus doesn't mean you can't get a bacteria after that. So things stop kind of clearing as much as they used to because you have that inflammation, and then bacteria can settle in that area. And that's when we sometimes treat sinus infections with antibiotics.
Would you say that someone who has chronic sinus infections, it could just be allergies?
Absolutely. Yeah, more often than not, that's the case.
Is there anything they can do in their home or in the environment in which they can control that can help relieve those seasonal allergies?
Absolutely. So knowing what you're allergic to helps. So sometimes getting tested, and sometimes people just know what they're allergic to. So for example, if you know you're allergic to pollens and grasses, don't mow the lawn, or don't go out in springtime when the pollen counts are really high, or go out more after it rains when the pollen kind of settles down a little bit. If you know that you're allergic to dust, there's dust covers that are available, there are dust filters that are available. There are a lot of avoidance that we recommend as first line for trying to treat allergies.
Great. So before we continue, let's do a quick couple introductions from behind the camera. We have Angela Jackson and Sonia Hamlin. They're both from the marketing department at UMMC Midtown Campus. I believe we have a couple questions from the audience. Sonia?
We do. The first question comes from Chanel, and she wants to know, why does my sinus infection cause severe headaches?
Great question. So as we talked about, the sinus infections, they cause inflammation in the sinuses, and sometimes the fluid builds up in these spaces that are otherwise air-filled. And so that causes a lot of pain and pressure because you have all this fluid there that you wouldn't typically have.
What can she do to get rid of the headache?
So Tylenol and Motrin are probably the best things to do to get rid of the headache acutely, because we don't want you to be uncomfortable as you're fighting the infection. And then various irrigation methods, so nasal saline spray, or if you can tolerate it, the neti pot or nasal irrigation often helps to clear some of that stuff and allow it to drain the way that it should again. It takes time, but it does.
How can you tell when it's a sinus headache versus a migraine or a tension headache or something else going on?
They have a lot of different characteristics. So sinus headaches, I think a lot along the lines of pressure that's in the face, so frontal pressure or maxillary sinus pressure, and then a diffuse headache that seems to come from that. In terms of migraines tend to be more light sensitivity, sound sensitivity, and then tension headaches I think of more along the muscles, so kind of coming from the neck muscles, and so you have the pain in the back of the head. You may have more diffuse pain, and you may also notice that it happens in periods of stress.
Do you think that it's true that some food allergies could possibly cause sinus headaches or sinus problems? Is that something people should be considering when they notice that their sinuses aren't maybe even getting better with nasal sprays or other things that they're trying?
So certainly that's in the realm of possibility. We know that certain foods can cause nasal congestion when they're taken, and whether or not that causes long-term sinus issues, I don't know that there's any information to say that that's the case, but getting tested for truly what your allergies are may be worthwhile.
Okay, great. Let's take another question from the audience.
The next question comes from Cecilia. Since my last sinus infection, my taste buds haven't been the same. Why?
So sinus infections, again, cause inflammation in the nose. So there can be two different reasons. One is that if you have inflammation in the nose, we know that the ability to smell affects the ability to taste. And if we have inflammation in the nose and the smells aren't getting to our smell buds, which are located in our nose, then we often are unable to taste as well. So that's one reason that might be the case. The other is that sinus infections, as we talked about, come from viruses. And viruses can attack not just the lining of our nose, but also the nerves that allow us to smell and taste. And sometimes that can be the reason as well. So it kind of just depends on the cause for that particular patient.
Just a quick reminder to continue leaving your questions for Dr. Gupta in the comments section below, and to like our page in this video if you haven't already. Let's take another question from the audience.
Sure. This question is from Bonita. She asks, I wake up with a runny nose and I have an itch in my ear and throat all the time. Could this be related to allergies?
Absolutely. This is a very common presentation of allergies, and it's we can definitely make you feel better, and it's pretty easy with over-the-counter medications. So for allergies, I typically will recommend the Flonase. We talked about, so Flonase, Nasacort, Rhinocort, the nasal steroid medications are very effective. They just have to be used consistently. For something that's a little more quick acting, I often recommend the third generation antihistamines. So Claritin, Allegra, Zyrtec, and the generic versions of any of those medications are equally effective. But if you take one of those a day, and even if you miss a day, no big deal. But when you have these symptoms and you take one, you'll notice decreased itching, decreased drainage, and I think you'll feel better overall.
Speaking of drainage, why do some people notice more sinus drainage at night?
So it's not that you're producing more sinus drainage at night, it's that when you're awake, you're clearing it. You're constantly swallowing, so although you may have drainage that comes down the back of your throat, you're constantly swallowing and clearing it. At night, you're not, and so it feels like everything kind of just gets stuck in the back of your throat, and so that's not uncommon.
Is there something that folks can do during the day to help prevent the drainage at night from being more significant? Is there something that they can take or do prior to going to bed?
There's a few different options. So one, we can irrigate the sinuses and try to clear the allergens that may be there. So again, neti pot, nasal saline irrigation, or saltwater sprays may help. And then also the nasal steroid sprays. Those are excellent for decreasing drainage and help overall. So sometimes taking a couple of sprays before bedtime. Again, don't expect that to work immediately. It usually will take a couple of weeks for that to be really effective.
And could that sinus drainage be contributing to some people snoring?
Not so much the drainage, but the inflammation in the nose, absolutely. So the inflammation from allergies can certainly cause snoring, and that can be compounded by other anatomic issues, and that's a good reason to see a specialist.
Great. Let's take another question from the audience.
Sure. This question comes from Daphne. My 11-year-old grandson was diagnosed with asthma and allergies and uses Flonase regularly. He's been having nosebleeds several times a day, complains of being lightheaded, and he's being seen by a doctor, but they don't know what's causing it.
So that's a really good question, and this is something that we do see from time to time. The nasal steroid sprays can cause nosebleeds if they aren't used correctly. So the key is that we have to place the nasal steroid nozzle in the nose. Again, we want to aim back and a little to the outside, and then do 2 sprays. If you aim towards the middle, that causes some damage to the nasal septum and can predispose to nosebleeds. So I would suggest kind of altering the way that the Flonase is used, and maybe even take a Flonase break. That may be an option too, particularly if the nosebleeds are getting bad. Nasal hydration also helps with nose sprays, so either putting Vaseline in the nose at night or the nasal saline gel, and then also saltwater sprays can sometimes help keep the nose more moist, which will help decrease the nosebleeds. And of course, we're always happy to see them. If this continues, it can be quite concerning, understandably.
Is there a certain age at which you should wait to start the nasal sprays? Or are there sinus issues that you notice are more common in children versus in adults? And what are their options for treatment?
Very good question. So kids actually don't have as developed sinuses as adults do, and we kind of develop sinuses all the way up to about age 10 or so. And so they tend not to have as many sinus issues. They can certainly have nose issues, they can have allergies, and oftentimes with kids, those nose issues will present as adenoid problems or adenoid infections, and we can treat that sometimes surgically and sometimes medically. Certainly we can use Flonase. Typically we don't recommend it for kids under 3 years old, but sometimes there's isolated incidents in which it makes sense to use it. So we do kind of take it on a case-by-case basis with kids, given that we don't have as much evidence for the medicine that we practice in children.
Right. I think we have one more question from the audience.
One last question from Adeline. She says, whenever there's a rainstorm, she gets congested and she's miserable. Is there anything she can do to prevent that?
In particular, no. The changes due to weather can sometimes be anatomic, actually, and so it may make sense to have your nose or your sinuses evaluated to see if there's a particular obstruction that may get more inflamed during barometric changes or seasonal changes. There isn't a lot of strong evidence to suggest that weather influences sinuses from a pressure standpoint, but it may be worthwhile taking a closer look at.
For our viewers who may still have some concerns about their sinus issues, what do you suggest for their next steps?
Well, certainly if you have tried a lot of the over-the-counter things and it's affecting your quality of life, this truly is a quality of life issue, and so we don't want you to be suffering if you don't have to. There are a lot of medical options, there's a lot of surgical options, and a lot of it is just education and learning about the disease and realizing it's a chronic disease and managing it. So we're always happy to see patients to help them kind of work their way along a medical path if that's what's necessary, or surgical if that's necessary as well.
At what point do you think someone should see a specialist versus trying to treat the condition themselves?
Well, I think if it's not working or significantly affecting someone's ability to work or go to school or concentrate, I think those are really important reasons to come and see somebody else for them.
Okay, great. For those of you who left questions for Dr. Gupta that we weren't able to get to, we'll reply back to you within 48 hours. And if you'd like to schedule an appointment with Dr. Gupta, you can reach out to University of Maryland Medical Center Midtown Campus. The phone number is 410-225-1000. Thanks.